I thank the gentleman, and I salute all of those who are here today offering these bills, this one and the four other related bills that are being considered, particularly Mr. Davis, who now holds the position as ranking Democrat on the Human Resources Subcommittee, a job that I've held for the last several years, and Ms. Bass, who has so ably led our foster care caucus. I only think that it's unfortunate that they're here. Unfortunate because all of this business should have been resolved last year. All five of these modest bills would already be helping children today, but for the way the so-called Family First Prevention Services Act was bungled last year. Each of these five bills were a part of it. But unfortunately, families, and particularly families caring for fostering children, have not and are still not among the first priorities of this Congress. Of course, here in the House, there are many speeches. We had extensive hearings year after year concerning foster children and the horrors of child abuse. But speeches alone can't do the job. And there are also many people of goodwill who genuinely care about this foster care problem in both parties. Ms. Wolarski is certainly one of those individuals. But all of us encountered a big problem last year in the Ways and Means Committee when the Family First Prevention Services Act came up. It was the same problem we faced in the last Congress when Senator Wyden and I offered a larger version of the same piece of legislation. The Ways and Means Committee majority leadership objects to adding a dime of additional revenue to accompany our speeches. The majority rejected my recommendation for a tax compliance measure to simply require the reporting of alimony payments. If you get alimony, it's a form of income, but there's no report required. This is not an increased tax. It is a way of avoiding tax evasion, and it would have raised the revenues necessary to fund the additional Family First Prevention Services. When this bill reached the Senate, the House's decision to reject that approach or any other reasonable pay for was instead relying on what you could call basically a rob Peter to pay Paul approach, cutting funds in support of adoption and shifting funds from one part of the foster care system to another part. And that, unfortunately, became the excuse in the Senate to block the bill from being passed. And I'll have to say that my home state of Texas, under federal court order to correct its many unconstitutional abuses in the foster care system, wrongfully led the way in blocking the Family First bill. As to the particular bills that we have up today, this one recognizes how mobile our society is and how much we need to be able to go across the country in addressing this problem. The earlier bill that we considered concerning children who age out of the foster system that Ms. Bass sponsored, really important. We heard time and again about the challenges that those children face when they're essentially dumped out on the street at age 18 or age 21, depending on which state they're in, and challenges particularly for young women who find themselves in that situation without adequate preparation or adult help. This bill that we considered addressed the primary problem of limited federal investment in helping these vulnerable older youth prepare for independence. I don't have any objection to it or to any of the bills that are being considered today. I object only to the ideological insistence of some in the majority that any additional revenue from any source, no matter how reasonable, cannot be placed in a deficient foster care system which too many of our states will not fix. And today's changes do not appear to add any actual new resources to foster care, and indeed they are likely to be overwhelmed by one cut after another that President Trump is proposing, particularly the Medicaid cuts that are being forced through this Congress that are very important to foster youth and to all children. So in this Congress, so indifferent to the education and social service and health needs of children of all types across our country, perhaps only taking a little step is the best we can expect to meet the needs of the most vulnerable children in our society. But I think all of us must be committed to work together to find a day when we are willing to take truly meaningful action before rather than after children, more children, are needlessly lost. And I yield back.